Welcome back to Health Bulletin, where we keep you updated with the latest health news from around the globe. So, without further delay, let's dive right into today's top stories. First up, we're seeing a significant surge in human metapneumovirus, or HMPV, a cases not just in China but also in several other countries. Meanwhile, Chinese's Ministry of Affairs releases Health Bulletin.
近期，我们已经多次回应了有关问题。冬季是北半球呼吸道传染病高发的季节，流感病毒是常见病原体之一。目前看，中国呼吸道传染病的流行规模和强度低于去年同期。关于你提到的人偏肺病毒，经向主管部门了解，这不是什么新毒株，在人类社会存在超过60年，是引发上呼吸道感染的常见病毒。人偏肺病毒感染表现为自限性疾病，把常见病毒渲染为不明病毒，这违背科学常识，是危言耸听，取得更多务实成果。中国政府始终高度重视本国人民和在华外国公民的身体健康。中方主管部门和技术机构主动开展多种急性呼吸道传染病哨点监测，并公开监测结果。疾控专家也多次介绍科学防护措施。中方也同世界卫生组织保持着密切沟通，及时分享呼吸道疾病的信息。中方将进一步采取必要措施，全力为境内外游客提供舒适、安全、便利的旅行环境。也希望大家共同努力，保护好家人和个人的健康。
As far as cases in India are concerned, there have been 17 reported so far. Even countries like Malaysia, Kazakhstan, the United Kingdom, and Singapore are also experiencing an uptick in infections. Since the first case in India, these cases were first detected at Bengaluru's Baptist Hospital. Cases of HMPV have been found in several parts of the country. All positive cases are receiving the necessary care and are under close medical supervision. Meanwhile, India's health minister has also released a statement regarding the current HMPV situation.
Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. HMPV spreads through the air by way of respiration. This can affect persons of all age groups. The virus spreads more during the winter and the early spring months. On recent reports, the cases of HMPV in China, the Health Ministry, the Indian Council for Medical Research, and the National Center for Disease Control are keeping a close watch on the situation in China as well as in the neighboring countries. WHO has taken cognizance of the situation and will share their report shortly with us. The country data for respiratory viruses available with Indian Council for Medical Research, ICMR, and the Integrated Disease Surveillance Program has also been reviewed, and no surge in any of the common respiratory viral pathogens is observed in India. Joint Monitoring Group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. There is no reason to worry. We are closely monitoring this.
Speaking of Singapore, towards the end of 2024, there was a noticeable rise in HMPV infections. However, the Ministry of Health clarified that this increase aligns with previous years. The surge is likely attributed to more social gatherings and holiday travel during the year-end festivities. According to an MOH spokesperson, Responding to the Straits Times, weekly HMPV cases among acute respiratory infection samples peaked between 5.5% and 9% in December. For those who might not be familiar, HMPV typically causes cold-like symptoms such as coughing, wheezing, a runny nose, and a sore throat. And these symptoms usually resolve on their own within 3 to 6 days. However, in more vulnerable populations, like young children, adults over 65, and those with weakened immune systems, it can lead to more serious conditions like bronchitis or pneumonia. Meanwhile, over in the US and the UK, hospitals are grappling with what's being called a Qua-Demic. This term refers to the simultaneous spread of COVID-19, the flu, respiratory syncytial virus, RSV, and norovirus. The convergence of these viruses is putting immense pressure on healthcare systems, leading to record admissions and stretched-thin pediatric wards and emergency rooms. Experts are urging everyone to stay up to date with vaccinations, maintain good hygiene practices, and remain vigilant to help curb this viral surge. In other important update, the China Center for Disease Control and Prevention announced on January 9, 2025, the country's first confirmed cases of Clade 1b Mpox. And these cases involve a foreign national who had been living in the Democratic Republic of the Congo and 4 close contacts. The China CDC swiftly initiated investigations across several provinces, including Zhejiang, Guangdong, Beijing, and Tianjin. Fortunately, the close contacts have only exhibited mild symptoms like rashes, and no additional infections have been detected among the broader population. China becomes the 12th country outside of Africa to identify Clade 1 Mpox, which is distinct from the Clade 2 Mpox virus that's been spreading globally. The novel Clade 1b virus is believed to spread more easily among contacts, particularly within households, and most cases have been linked to travel from affected African nations. As we navigate through these updates, it's clear that global health requires our constant attention and cooperation. The World Health Organization is closely monitoring these developments and continues to work with countries worldwide to manage and mitigate these outbreaks effectively. Listen what WHO has to say.
There has indeed been a rise in a number of common respiratory infections in the country, and this is entirely expected during the winter. China has a sentinel surveillance system for influenza-like illness and severe respiratory infections. According to the Chinese CDC data, the pathogens causing these infections are known ones, and they include the seasonal influenza virus, the respiratory syncytial virus, also known as RSV, and of course the human metapneumovirus, HMPV, as well as our old friend SARS-CoV-2, the virus that causes COVID-19. Now, among the pathogens reported by China CDC, seasonal influenza is by far the most common that's coming up in all the testing, and it's increasing. The test positivity rate for influenza at the end of December was over 30% among people presenting with the flu-like symptoms in outpatient and emergency department sentinel sites. China's reported levels of respiratory infections are within the normal range. It's what we expect to see for the winter season. Authorities report that hospital utilisation is currently actually lower than this time last year, and there have been no emergency declarations. Regarding human metapneumovirus, it's not a new virus, so it's got an unusual name, so there's been a lot of interest. But it is not a new virus. It was first identified in 2001. It's been in the human population for a long time. It is a common virus that circulates in winter and spring. It usually causes respiratory symptoms similar to the common cold. So our advice to those who are in the winter season is to try to avoid getting ill in the first place, try to avoid getting infected, and simple measures. As we know, we've all been very well trained by coronavirus.
Staying informed and following health guidelines are our best defenses against these viruses. Simple actions like regular hand washing, wearing masks in crowded places, and getting vaccinated can make a significant difference. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to Health Bulletin for more updates in health and science.